Well, now these insurance companies are going to be government contractors in essence, and our rates are going to go up, Congressman. Our insurance rates are going higher. It's inevitable.
Well, you're absolutely right. If you look, we have seen insurance rates rising as much as 50%, and we have seen it happening in 11 states, including our own. So don't think that this is going to happen because of the legislation.
The president said in the campaign his health care system was going to reduce insurance by $2,500 a year per family. It's what he said over and over and over again.
Well, remember, it has not yet gone into effect.
Now, we both know it's not going to happen.
Well,
but you know what the biggest concern is? People are threatened with fines. They're being forced to pay for insurance. They're threatened with fines or jail terms if they don't. This is something bothering people.
Jail terms, no. They will have to pay for not participating. But understand, this system will only work, Frank, if everybody participates. Because let me just give you an example of why we have to do that. Right now, Americans have paid between the first of this year and this date in excess of $52 billion in additional health charges that they pay on their own health insurance and on their own payments to the hospitals because of people who are not covered by insurance and who are going to emergency rooms to get free care. This is going to be stopped, and we're going to work it out so that people who want health care and need it can get it. We're going to eliminate the behavior of insurance companies in canceling insurance. We're going to control the behavior of insurance companies and prevent them from denying people care and insurance because of pre-existing conditions. I heard the other day of a case where essentially a woman was precluded from health care because she was a woman. That was considered to be a pre-existing condition. And things like acne are considered to be pre-existing conditions.
But those are not common occurrences, Congressman.
Well,
we know
my friend,
we're going to hear horror stories when government health care begins to.
Frank, it hasn't begun, and you're just spreading a lot of useless terror rather than participating in seeing to it that we have an intelligent discussion and that we move towards understanding and resolving the problem.
Pardon me, Congressman? I am spreading useless terror?
Yes, sir.
Did you really say that?
And there's a lot of other people that are doing that, too.
That is, I've never heard you talk that way to an interviewer, and I got to tell you, I'm absolutely stunned that you would say such a thing.
Well,
we have a government that is taking over the healthcare system of this country right now. Beginning with the insurance industry, Congressman.
No. There you go again, Frank. The government is not taking over the health insurance industry.
The government is deciding what should be covered by insurance companies for the citizens of this country.
What we are doing is seeing to it that Americans have the health care they need to live longer, to live better, and to live healthier lives.
We have that now, Congressman.
No, we don't.
Yeah, we do.
Because, Frank, do you want to go tell that to the 32 million American people that are going to get coverage and to the 47 million people who do not now have coverage?
Those people number and cover a lot of different demographics, don't they? There are a lot of people who choose not to have insurance who actually pay for it themselves, who pay for health care themselves.
There are some of that kind, and they will be able to continue to do so. But they will under this pay a modest charge for not doing so, because a lot of those people are then, when they find that they're in trouble, going to emergency rooms, and the rest of us are paying their bills for them.
And now we're doing it on a much wider scale by having people pay those bills in advance.
Well,
what's the difference?
You're dead wrong on this, my good friend.
Well,
we are first of all not taking over the insurance business of the United States. We're simply seeing to it that they provide an orderly mechanism of delivering benefits to the American people.
And determining what those benefits should be,
and deserve.
Congressman. If you're telling them what those benefits should be, then you are controlling them.
Beloved friend, that's exactly right. We're telling the insurance companies what they should do in terms of providing service to the American people.